Hi, I'm Dr. William Wood. I am the newest member of the team here at Alabama Weight Loss Surgery, and I'm joined here by Dr. Lee Schmitt. Dr. Schmitt, I just wanted to thank you guys, you and Dr. Miles, for bringing me into the practice. I've been doing surgery for a little more than 20 years now, and I can really appreciate and tell that you guys are doing excellent work here. And I can assure the patients that, or potential patients that may be watching this, that there's excellent results and excellent surgery being done by your practice. And so thank you guys very much.
Well, we're glad to have Dr. Wood. I hear all the time, I get messages on Facebook, people say, I need you to be my doctor because my doctor retired. My doctor died. That's sad, but I hear it all the time. And I'm thinking, these people, these practices didn't make any preparations for the future. I've been doing this, I've been in practice for a long time now. I finished training in 95. And when I retire and when Dr. Miles retires, Alabama Weight Loss Surgery will continue. So we're making preparations that nobody's going to be in that situation where they don't have an expert weight loss surgeon to continue to take care of them, because lots of my patients are going to outlive me, and we're going to be here for you. So we have a really good national reputation, and we're able to pick and choose and find a really good surgeon. Dr. Wood is someone we've known for a long time, and we're very happy that now he's going to transition from doing general surgery to doing nothing but weight loss surgery, which is something that he has done in the past, but it has not been his focus. So we're very happy to welcome him to the practice. And so some of you who are thinking about having surgery, I'm sure you will choose to have your surgery with Dr. Wood.
Well, I'm really excited about it. Dr. Schmitt and I thought about doing a little mini series to talk about several different topics. And what we picked out today is the issue of an academic surgical training program. All three of the surgeons here, we've all trained in an academic center. And you guys, potential patients, may be wondering, why should you care if a surgeon trained at an academic center as opposed to somewhere else? What good is this specialized training, like learning to do organ transplant or taking care of trauma patients? Why should a patient care, Dr. Schmitt, if you or I have helped save somebody's life after a gunshot wound?
Well, most people don't know necessarily how surgeons get trained. You go to medical school, and if you do really well, when you go to medical school and you're ready then to do training as a surgeon or as a internal medicine doctor or whatever, you apply to programs and you ask them, say, hey, I want to go to, say, the Mayo Clinic and get my surgery training, which I went up there and interviewed with them. And that'd be good if I was doing endocrine surgery. They're very specialized. It turns out, for Mayo, great program, but you don't get to do a lot of surgery up there, because they are doing such, they're not like a tertiary referral surgery. They're like a 4 times removed, whatever the adjective is. So at one time they got in trouble because their trainees, their residents, weren't getting enough surgery. So there are different programs I think are better than others, and certainly the best program for training around here, and one of the best, in the country is UAB, and we both trained at UAB. Dr. Miles trained at a university program in Chattanooga, another busy place. But it's kind of it's a dirty little secret. A lot of people will train in general surgery, and then they will have not gotten to do enough cases, and they don't feel comfortable doing surgery on their own, and so they'll say, I'm going to go do a fellowship, because they know they need additional training. A fellowship is after you've done your surgery training, well, now I'm going to go do another 6 months, another year of only colon and rectal surgery, and then I'll be a colon and rectal surgeon. Or I'm going to go do a training in minimally invasive surgery, because they didn't get to do enough minimally invasive surgery in their training. And so a great thing about UAB was that, we went to the VA hospital, went to University Hospital, went to Children's Hospital, went to, when I was there, it was called Lloyd Nolan, then it became something else. and Cooper Green Hospital. So we got tons of training in a wide breadth of surgery, and got a lot of experience doing surgery. So when you learn surgery, you don't necessarily learn. I mean, our boss, Dr. Deedham, didn't say, they don't teach you how to do a case. They teach you how to operate, because every case can be different. When something unexpected comes up, you need to know how to deal with it. And that's why, when you have done transplant surgery and you've done, all these other different surgeries that you get to do at a academic busy center, you are prepared to handle all kinds of complications.
I tell you what, it really gives you a sense of peace and confidence to be in an operation, and unexpected things happen during surgery. That's part of it. You need to be prepared to deal with those things, and it sure is, gives a lot of peace of mind to know that you've handled very complex things in the past and the unexpected things that you must deal with.
I think some people, their personality is they like, excitement and the challenge, and my surgery's boring. I used to be a guy who, raced motorcycles and jumped out of airplanes and did a bunch of crazy guys and crazy things, maybe an adrenaline junkie at one time. And I have been in cases back when I was a general surgeon where something happens and you feel that rush of adrenaline and you feel, the chill go over your body. And when it's over and you have done the right thing and taken care of the patient and everything turned out great, you'd get a high.
For sure.
You would get this rush, and man, it was exciting. I don't feel that anymore, because what I do, all I do is weight loss surgery, and when you do literally, 1,000 or more a year, unexpected stuff doesn't happen that often.
Right.
So my surgery's boring.
And that's what you want as a patient, a
you
boring
and
operation.
you want it as a surgeon too. But yeah, you are prepared.
Well, thanks for taking the time here today. And where can the patients reach out to find out more about weight loss surgery?
So everybody knows who follows us online, whether it's our YouTube channel or the Facebook page is very popular. Go to our website, alabamawls.com, and watch our seminar, learn more. And you'll learn about us, and you'll learn about weight loss surgery, and we would love to help you.